The World Health Organization says Nigeria is Ebola-free. This after 6 weeks with no new cases.
Other parts of Africa are still dealing with the virus, and a 16 WAPT's Tammy Essek reports that has some Mississippians still on edge.
As the Ebola death toll rises in Africa, concern increases in Mississippi.
How do you really catch it? I mean, is it casual? They say it's fluid to fluid. How fluid to fluid?
Ricky Moore heads the Hinds County Emergency Management Agency. He says they bought gear to deal with a possible outbreak.
We do have some equipment available. We're not just sitting on our hands and not getting prepared.
Moore says a grant helped them buy 30 suits. The EOC says emergency teams can use them if they have to transport an Ebola patient.
If something arises here that we could protect our first responders.
Family doctor Tim Quinn treats roughly 40 patients a week at his Jackson clinic. He says Ebola is a hot topic with his clients.
How many of those patients have come to you and asked you about Ebola?
Well, the number is increasing. The main question I get is, what are the chances that I will get Ebola?
Fever, fatigue, muscle aches. Doctors say some of the same early symptoms of Ebola mimic the flu.
Ebola does have more severe symptoms than the flu, especially as the disease progresses on. There are bleeding disorders with Ebola.
Mississippi has had 0 Ebola cases, but there's been several false calls. Officials evacuated dozens of people Sunday from Jackson's train station after a man threw up inside. He was transported to UMC, where doctors determined he did not have Ebola. 2 days earlier, Baptist Hospital treated a man complaining of Ebola-like symptoms. The spokesperson says he was cleared too. No Ebola in Tupelo, Vicksburg, or on the Gulf Coast, where several people checked into the hospital last week. Whether it's undue concern or not, Mississippi officials say they're trying to make sure residents are covered. In Jackson, Tammy Essek, 16 WAPT News.